Hello everyone, good evening everybody. I am Sanya from Prostate Wellbeing Team. I'm sure all of you must be keeping good health. Today we are going to discuss a very important topic, that is surgery for male infertility. Male infertility is a common issue that can be caused by a variety of factors including blocked sperm ducts, very small enlarged veins in the scrotum, hormonal imbalances or issues with sperm production. For many men facing infertility, surgery can offer a potential solution, especially if other treatments like medications have not been effective. To throw more light on the subject and guide us on various options available on surgery for male infertility, today we have with us a renowned urologist, Dr. B. Krishna Mohan, MS, M.cH Urology, Chief Consultant Urologist, Andrologist, and Men's Health Specialist. He is currently practicing at PSG Hospital, Peelamedu, Coimbatore. We welcome you, Doctor.
Yeah, hi, good evening. So hope everybody is doing fine, and also I good evening to all the audience who are watching this session.
Yes, doctor. And as we are going to discuss a very important topic, that is male infertility, my very
Yeah.
first question to you is what causes male infertility?
So male infertility is it is a wide disease. So it has a lot of diseases coming within it. So it can start from, as you said, can start from a varicocele, which is a dilatation of the blood vessels going to the testis. And also it can come from obstruction or blockage of the semen tract, the tract which the semen comes, or it can be due to other hormonal imbalances as well that can lead on to male infertility. Sometimes sexual dysfunction, erectile dysfunction can also lead on to male infertility. So it is a very broad spectrum of diseases that can cause male infertility. So that is in brief. Yeah.
Okay, so these are the causes of male
Yeah. Yeah.
infertility.
Yeah.
Doctor, as we are going to discuss about the surgery, so how
Yeah.
can surgery fix male infertility?
Yeah. So surgery is plays a role in male infertility. Certain conditions in male infertility, as we said, varicocele, can lead on to subfertility and infertility. So this will require a surgery called as microscopic varicocele lectomy or varicocele repair. And also in, as I said, that there is a blockage in the tract which is carrying this semen and the sperm, that also has to be corrected by surgery. There are various procedures depending upon where the blockage is. It can be an endoscopic transurethral resection of the ejaculatory duct if the distal ejaculatory at the end ejaculatory duct is blocked, or it can be a procedure like vasoepididiostomy, or an epididymostomy can be done if the blockage is more proximal. And also there is surgeries for if there is erectile dysfunction, and that is calling infertility. We can also provide penile implants for the patients. Yeah. So this is in brief about the various
Okay,
surgeries.
doctor. And doctor,
Yeah.
what are the most common surgeries
Sorry. Yeah, I didn't get you. Yeah, one. Yeah. Can you repeat the
Yes,
question,
doctor. So
please?
my question was, what are the most common surgeries for male infertility?
Yeah. So first, I would say it is microscopic varicocele repair or varicocelectomy. And the second most common, I forgot to mention another two more things. That is microscopic testicular sperm extraction, as well as microscopic as well as testicular sperm aspirations. So this is for if you don't have sperm. If it is zero sperm in the semen, then we will have to take this sperm directly from the testis. It can be done in two. You can just aspirate a minor surgery, or it is a major surgery like microscopic testicular sperm extraction also can be done. So, and also, as I said, there are sperm, if there is a blockage in the tract, we do major surgeries like vasoepididostomy or in patients who have undergone vasectomy for family planning. If they require pregnancy again, you want to pregnancy again, want a child again, then we do vasectomy reversal as well. And for these patients with erectile dysfunction, we offer a varied penile implants according to their lifestyle, so that it can prevent their erectile dysfunction. Yeah. So
Okay,
each
okay, doctor. So
surgery,
these are the
even
most
one,
common.
yeah, common surgeries that I do. Yeah.
Okay, okay, doctor. And doctor, here's come a question: that are the surgeries safe? What are the risk factor which are involved?
Yeah, so the most of the fertility surgeries are not a significant surgeries that can lead on to risks or morbidity or mortality. So these are surgeries which will require anesthesia, but these are comparatively it is not a major surgery that has any life risk or anything like that. So these surgeries do have complications. So we will talk about it as we discuss about other at each surgery. Hope it is
Okay,
clear,
okay.
or should I repeat again?
Doctor, can you please repeat
Yeah.
that what are the risk factors which are involved, and are these surgeries safe?
Yeah. So these surgeries are comparatively minor surgeries. It's not a major surgery that can lead on to life risk or anything. So the patients can be rest assured that these are safe surgeries and doesn't have any life risk. But each surgery has its own complications. Minor complications can arise post surgery for any surgery, so that each surgery we can explain it as we go upon in this session. Each surgeries will explain in detail. Yeah.
Yes, yes, doctor, absolutely right. And doctor,
Hello. Yeah, now are you
yes,
able to
doctor.
see? Yeah, yeah, some glitch, sorry. Yeah,
No,
yeah.
no, no
Now
problem, no problem.
yeah, yeah.
No problem, doctor. As we were discussing about the male infertility and the
Yeah,
surgeries,
yeah. Correct.
doctor, any precautions one should take before and after the surgeries, and any lifestyle changes?
Yeah, so these surgeries, definitely we ask the patient to have, we advise them lifestyle changes. So, first, for any male infertility patient, we would advise a good diet. So, good diet which is rich in vitamins and minerals and micronutrients, which are available in fruits, vegetables, green leafy vegetables, as well as plenty of water. And generally, we do ask them to avoid excess of dairy products. So, excess of milk and dairy products, because these dairy products do have some amount of hormones in them, so that can affect their fertility. And as well as we do advise them a good exercise, a good daily brisk exercise for 30 to 45 minutes daily, so that they do not they gain weight, or they are fit. So we do advise them, yeah, before surgery. Yeah.
Okay, doctor. So these are the some lifestyle changes which are required for surgeries,
Yeah, yeah.
especially
Correct.
the
Correct.
infertility. Doctor, what are as we have discussed about the surgeries, and as we are going to discuss about how the different surgeries, as you told that there are less risk factor involved, how a person usually don't go to see a urologist, what advice you would like to give to those people who don't openly talk about these topics?
Yeah, see, because this male infertility is a taboo in our society, though they are very reluctant to go and consult a urologist or an andrologist regarding their male infertility. So the thing is, certain infertility issues, if they come early, can be treated with medications as well. So, and also certain problems, if treated early with surgery early, so the outcomes of pregnancy are more. So if they come too late, even with surgery, we might not be able to correct the infertility. So that is why we tell them to come early. If they first time when they say, if they get married after 1 year, if they do not conceive a child, the couple has to come for infertility checkup as well as treatment.
Yes, absolutely, doctor. And doctor, how soon after the surgery the patient can try to conceive?
So yeah, I will talk about the three common surgeries in detail, and then we will take up this question. Okay. So if you give me a 10 minutes, I would just explain each surgery, what we do. So first, can I proceed?
Yes, please,
Yeah,
doctor.
yeah. Yeah. So the first surgery would be microscopic varicocelectomy. That is for varicocele. So varicoceles are the most common infertility causing disease that we see in males. That is because of the dilatation or accumulation of venous blood. That is the bad blood above the testis because of the dilatation of the veins, engorgement of the veins. What it does is this decreases the blood flow to the testis, which leads on to male infertility due to decreased sperm production. So what we do in this surgery is we tie up the blood vessels that carry this bad blood to the testis, so that the blood circulation is improved and the sperm production improves. So we do this surgery by a microscopic technique. So there are laparoscopy or the open surgeries, but the best outcomes are through microscopic varicocelectomy. That is what we do. So this microscopic surgery, varicocelectomy, is a very minor surgery that takes around 2 hours to complete. So both sides we would be doing if the patient has the problem, both sides, or whichever side which has the varicocele. So generally, it is a very minor incision. It's around 1 to 2 centimeter only the incision, and it is cosmetically, it doesn't cause much of scar, and also these patients recover early. And this is done for usually when the varicoceles are very significant, say grade 3 or more, and they have significant infertility or they significantly less sperm. And the next surgery would be, as I said, for obstruction or blockage of the sperm carrying or semen carrying tubes. This can occur anywhere along the tract, right from the testis to the urethra, so where the urine comes, so that passage. So what happens is, So if the blockage is more proximal towards the testis, we do something called as connecting the vas. Vas is the tube which kind of takes the sperm from the testis, and the epididymis is a tube which a larger tube which is near the testis. So we cut the portion which is blocked and then connect it to the epididymis, which is called as vasoepididymostomy. And all these surgeries are done under microscopic vision, because which provides better results because it is more precise and less of complications, and a more success rate of producing sperm uh, in the semen. So, and then this another surgery is if there is a distal obstruction to at the ejaculatory duct, we do an endoscopic surgery where we cut open the ejaculatory duct so that sperm freely passes into the urinary tube. And then these surgeries are the complications can be there, but it can be minor complication. And after that, so the thing is, these. These surgeries, post the surgery, these patients can have some infections or bleeding at that local site. But when you do it in microscopic, the complications are more minimal. And next surgery would be the testicular sperm aspiration, where the patients who have nil or zero sperm in the semen, or very less severe oligospermia in the semen, we what we do is we put a needle into the testis, directly into the testis, and then aspirate the sperm out and use it for IVF in or artificial reproductive techniques, or in vitro fertilization. So this can be done, and also if this is also unsuccessful, what we do is a microscopic testicular sperm extraction, which we do under a higher magnification under a microscope, and this yields better results than a aspiration, because we directly see the tubules which carry sperm and directly take the sperm containing tubules. So the success rates of sperm extraction would be higher in this surgery. So lastly would be a penile implant for a erectile dysfunction. So the penile implant is there are two types of implants that would be a inflatable and a non-inflatable, which would be a malleable implant. The inflatable would be there would be a button they can press and they can get erections on demand. But the malleable prosthesis can be bendable and can be kept under the undergarments. So this is in brief regarding the various procedures that we can do for male infertility and sexual dysfunction. So this would be in brief. Yeah. So we can take the next questions. Yeah, please.
Okay, doctor. Very well explained the various types of surgeries which are there for the male infertility. And now comes the question that how much time a person can try to conceive after the surgery.
So generally, after microvaricocele procedure, the patients can start their trying for a pregnancy. So after maybe 1 to 1.5 months. Okay. So usually after microvaricocele, the good results would start appearing maybe at the end of second month and or starting of the third month. So they might have to wait until then, but they can start their planning after 1 to 1.5 months. Yeah. So
Okay.
and for the sperm extraction, it is basically we take out the sperm directly, so there is no waiting period. Directly they go for IVF and that they can get the pregnancy. Yeah.
Yes, yes, doctor. And doctor, as we have discussed about the risk factors which are involved in after the surgery, post surgery, what are the risk factors which are involved? And as you have told us that there are many surgeries. If the first one is not trying, then the second one is always there. Doctor, there are a lot of people who don't talk about this issue and who don't go. And as I told you that what advice you would like to give, so you have given advice as well. But after surgeries also, people don't take care of themselves. They think that once the surgery is done, they can back to the lifestyle which they already have. So what advice you would like to give to those people who don't take after the surgery treatment properly, or they think that the work or the process is done and now I don't have to take the medications properly, and they left the treatment in half.
Yeah, so generally post surgery, the we do it in the part which is perineum or the private area. So it is very important to maintain proper hygiene in that area post surgery. So commonly we do get infections in that area because they don't have proper hygiene post surgery. So any surgery with that we do on the testis or in the private area, so that requires a proper cleaning and proper hygiene of the wound post surgery so that it heals properly. And even be it testicular sperm extraction or anything. So post surgery, they will have to follow up for the IVF and the pregnancy. So the couple has to take certain precautions, and also the person's wife has to go about the proper instructions given by the gynecologist for the pregnancy. So it requires regular follow up until the child is born. So, and also other complications that can arise after the surgery is apart from infections is bleeding at the site that can occur even after any surgery. And also after surgery, there can be the success rate depends upon the stage of the disease, and also what is the severity of the male infertility or the sperm count. So certain problems can have a low success rate depend if it is very severe. So the patient has to follow up, and if the patient has a complication, we would have he might require a minor surgery to let out the to control the bleeding or to control the infection. So post penile implant, the most worried complication would be an infection, because we keep a silastic or a foreign material within the body, so that can lead on to infections or reactions. So if the infection, so that is why we tell post penile implant they have to have a proper hygiene, because infection rates if are high, and if it occurs, we might have to, if it is a severe infection, we might have to remove the implant so that it doesn't cause more harm in that area. And then the next thing is uh, the once the surgery is done, certain tests would be required post surgery. So for that also the patients has to follow up.
Okay, so that means proper taking care is important, and as you said that there can be some complications, so they have to go and say, doctor, are these surgeries safe?
Yeah, see, all these surgeries are elective procedures and they are safe, and they do not carry much of life risk. The patients can be what to say, they can feel safe and they can be confident in undergoing these procedures, and so they did not worry. Yeah.
Yes, yes, doctor. And we have some live viewers questions as well
Yeah,
who are
sure.
watching this live. So there's question that should I follow up with my doctor after surgery?
Definitely, you have to follow up because once any surgery would have a wound, so that we have to check whether the wound has healed well and whether the problem which they have come is rectified. And we would like to follow up with the in male infertility. We would follow up the wound. We will follow up this sperm count, how it is improving, whether it is sufficient to undergo IVF or is it under sufficient to have a pregnancy. So that also we will follow up. So follow up is very important, and also I would like to stress wound hygiene and maintaining a proper cleanliness also very important.
Okay, okay, doctor. So wound hygiene and taking care of cleanliness is very important.
Mhm.
Doctor,
Yeah, yeah.
here's another question that I need to make any lifestyle changes after surgery to improve fertility.
Yeah, definitely lifestyle has to be. So any male infertility, we advise the first thing would be a lifestyle modification. So most of these patients would have some obesity, or they will have other lifestyle issues. They might be smoking, they might be taking alcohol regularly, so or they might have some substance abuse or something like that. So we would advise to quit smoking. We would advise them to quit alcohol as well. So and then we would advise them to take a good rich diet which is rich in vitamins and minerals and essential nutrients which are available in fruits, vegetables. And we would ask them to have some amount of protein daily according to their weight, so that they are replenished as well. So and then diet would be the also we would like to modify in these people. And also we would ask them, if they are obese, we would ask them to reduce their weight according to your body mass index, BMI. And also we would advise them importantly to have regular exercise, at least 30 to 45 minutes of brisk exercise daily. And yeah, so these would be the things. And another important thing is, in this electronic age, so people use laptops, mobile phones, and frequently they keep it on their laptops, or else they keep their mobile phones very near the private area testis. That can lead on to radiation exposure, and also increase in temperature of the private area and the testis, which can lead on to infertility as well.
Okay, okay, doctor. I think that's a very important point. We are discussing about male infertility. There are more questions coming from our live viewers.
Yeah, yeah, yeah.
There's a question that uh, is male infertility surgery always successful?
Yeah, it depends upon, so each surgery, the success depends upon the severity of disease that the patient comes to us. So that is why we tell them to come early. So any problem at the earliest, if you come to us, we would be able to give a proper treatment, and a proper surgery would have good outcomes. So that is why, if the patient has severe infertility and other issues, genetic issues that hamper the testis to produce sperm, then the sperm retrieval rate can also decrease drastically. So in those patients, the outcomes might be bad compared to earlier coming patients who come early. And yeah, for these patients, we would explain to them clearly that their outcomes would be bad, and then only take them up for surgery, so that they are informed previously before the surgery.
Okay, okay, doctor. And doctor, as we have discussed about the various type of surgeries, there is a question that can Verisol surgery restore fertility?
Yeah, so it restores fertility, so and also improves the sperm parameters. Okay, so it increases the count as well as the sperm parameters, provided the varicocele is the only problem that the patient has. If he has other issues as well, we would like to correct them as well, so that the improvement is there. Okay, so sometimes what happens is if the varicocele, if they are had for several years, which are more than 10 years, and the testis has shrunken and the sperm production is so grossly affected, then in these patients, the sperm count might not improve even after varicocele surgery if the testis has shrunken, and because they have left the varicocele unattended without getting a proper consultation or surgery before itself. And so in such patients the outcomes might be bad, so the sperm production might not improve even after surgery. Yeah.
Okay, doctor. And doctor, for for all the males, how much time they should go for regular checkups to the urologist?
So yeah, these patients. You are asking for patients with male infertility, or
In
before surgery
general
or
as
after?
well. In general as well, people don't go for regular checkups. So
Yeah,
how it
yeah.
is required?
So yeah, for we'll talk about male infertility aspects. So that is why we have something called as premarital checkup, health checkup. So why is this important? This is a very important question. So why is this important? So nowadays, most of the people are getting married after the age of 30. So it has become the norm. So what happens is the ideal reproductive age group would be less than 35, moreover less than 30. So once you cross 30, the infertility issues increase, the incidence increases. So as you grow old, the chance of infertility also grossly increases, both for males as well as females. So that is why what we say is, before they get into wedlock, we would ask them to get themselves a premarital checkup where we check their everything. We check their general health as well as their reproductive health as well, their sperm count, everything. So if there is anything, we would address it before their marriage, so they're confident when they get into marriage. And after, generally for other people, if a general health checkup is for males is always beneficial, they can, if they do not get it yearly, at least they can get it biannually, once in 2 years, so that we can detect any health issues early and we can treat.
Okay, okay, doctor. So if yearly one checkup or in 2 years one checkup is
Yeah, yeah,
important.
yeah, yeah,
Okay.
definitely.
Okay, doctor. So very informative session about the surgeries. We have discussed about the importance of why we go to regular checkups as well. Doctor, any myths and misconceptions you like to clear for male infertility?
Yeah. So misconception is this entire disease, male infertility, is a taboo in our society. They do not want, most of the males are reluctant to get their consultation for male infertility, treatment for male infertility. They do not approach the andrologist or urologist. They only approach when the everything is been, so all the after, only after the problems have worsened to an extent that they cannot wait further. So most of the patients come at that instance only, when the sperm count is completely zero, or once they have tried for 5 years for pregnancy, and they 5 or 10 years, they come at that late stage. So that is the problem. So that is the myth, is they think that they can cure by themselves. They just diet, they will take some medications, native medications, and without getting to know what the actual problem is. The problem might be simple, but they leave it for so many years. It can become a problem, which can lead on to severe. So that is what we say. If you come early, we can treat early, and you can come back to normal. So they think that surgery, it will complication, or surgery is a very major procedure. It has so much issues. Everything they have for this, for male infertility especially, they think that if they do surgery, their whole manliness, or they think that the community or society will know and they will seclude them. What I would say is male infertility like any other. So if you come, you get like a heart problem. When you come, you get sick, you become normal. This that like so.
Yes, doctor, and as you have cleared all the myths and misconceptions which are related to male infertility, and we have talked about how the in male infertility, about the surgeries, about the post surgeries maintenance, what everyone has to keep. Before we end this very informative live session, any takeaway message for all our viewers watching this live?
So what takeaway message? Male infertility, but uh, uh, urologist proved outcomes uh, to not sort of outcome.
Yes, yes,
So
doctor, and
I would also for viewers for hope for more.
yes, yes, doctor. And all the myths and misconceptions, and their viewers also ask questions as well about male infertility. And I'm sure they will take this advice. Thank you so much, doctor. Thank you so much, Dr. V. Krishna Mohan, for your valuable time. And it has been very quite informative session for all our viewers as well.
It was a as well as the audience. Hope
Thank you, doctor. And we really look forward for many more such sessions in the coming time as well.
yeah, sure, definitely. Yeah, bye.
Thank you so much, and thank you to all the viewers for an excellent participations. For more information and updates, stay connected on our Facebook page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you, and good day to you all.
Yeah, good day, everyone. Yeah, bye.
Thank you, doctor.